A healthy population will be a working population. Since my people are very commerce-based, it becomes important that we face the health sector majorly.
Uju is a young lady from Ogbunike in Oyi local government area of Anambra State. She's from a family of 9, and after she lost her brother and her father, she picked up the responsibility of caring for her younger ones and her mother while working as a photographer. Everything was fine until sometime in 2019 when she noticed something was wrong.
It started with me feeling a little bit of hardness below my abdomen. So I confided in someone in my office, and she said, okay, I'll take you to my doctor. He's very good. So when I went there, after so much examination and then scan, he said, I think you have fibroid. I became emotionally down. I wouldn't know what to describe the state I was. I started thinking differently. At a point, I had to take pills to sleep. I don't even know who to talk to. So I kept it all to myself. I pray sometimes, I say, God, please, just take this thing off my mind. I don't want to remember it. I don't even want to think about it. So for a whole year, I took it out of my mind. Like in my family, we have this very flat stomach, but mine started coming out. My people know why it's coming out. I know, people don't know. So most times when I dress, people are like, come, this girl, are you sure you're not pregnant? When I see them, I just put up a smile. Even when I go to the office.
As time passed, Uju's body continued to experience changes, and even her monthly cycle became something to dread.
There is this fear of how much blood will go out this time, how much pain will I have this time, will Panadol solve my problem this time and all that. So there was this particular one I had, I thought I was almost dead because I couldn't move. I decided I was going to see a doctor. And I remembered a doctor that I've heard stories about him, how he has been helping people, not fibroid, but with childbirth, complications and all that. And he has been very successful.
Uju got an appointment with the consultant.
She had a fibroid that is located inside the womb, what we call the submucous fiber, associated with heavy menstrual bleeding. And of course, you can know when a woman is losing blood heavily every month, and she was quite bad.
After examining her and reviewing her test results, he set an appointment date for her surgery.
I said, sir, please let me ask you, how much will this cost?
Up to 200 to 300,000 now.
Not like I have the money at hand, but I said, I am going to borrow, I need to get this thing done. Someone told me, I think you registered for ASHIA sometime. I said, yes, but that ASHIA thing, I don't know. He said, go and meet those people first.
I was in the office, and then she comes in crying. And I said to her, if you are an ASHIA enrollee, why are you coming to me? It's not necessary to come to me. Go to the hospitals. And she goes, I'm not sure ASHIA can do this. I'm like, who says ASHIA cannot do fibroids? We have done fibroid surgeries, I'm not exaggerating, in the last 2 years, in the list, 25. So why do you say ASHIA will, I mean, go to the hospital, go to your healthcare provider, present yourself, and they will check, and they will request for authorization code from ASHIA. Once we get the code, we will approve. It's your right as an enrollee of ASHIA.
So when I called them, I was like, what do I need to go with? They said, just go with 40,000 naira. On phone. I was like, hello, excuse me, sorry. Hello, can you hear me? I wanted to hear them very well. Let me be sure if it's 40,000 naira out of 250 I heard. On Wednesday evening, I got my things here. When it was time, the doctor came like, okay, let's head to the theater. I lay down on the bed and the doctor said, pray for us. I think that was the last thing I remembered.
Today, ASHIA has foot the bills of paying for her to undergo 3 procedures in one. Because whereas ASHIA gave pre-authorization for her to have myomectomy done, when the surgeon went in, they saw 2 other conditions that they needed to contend with. And then knowing clearly that over time, ASHIA has demonstrated focus and integrity in terms of paying their claims to different hospitals, that consultant went ahead and did the procedures. So when the governor tells you that he has set up this scheme to ensure that the poor and downtrodden can access any level of health care that the rich will access, he means it. The man came with a vision, and we are running with a vision. It's as simple as that.
Today, Uju is happier, free of the burden she carried in her body, and extremely grateful.
ASHIA coming in, I think, is a big relief to so many of us here in Anambra State. At Wokodike worldwide, your position in Anambra State, you being the governor of Anambra State, has brought a lot of difference, a lot of new dawns, a lot of hope. You've given voices to people. Someone like me, will I be here today talking like this? I really want to thank the governor of Anambra State, Chief Willie Madabrochukwu Obiano. I want to thank you, ASHIA. God will keep blessing you people. And as people are doing it for us, God will keep doing it for you people. I don't know how to thank you. Words have failed me right now, but people should just know that I'm grateful. And trust me, I'm one of those people that will keep telling people to come out and register. You don't need to get sick for you to get a health insurance. Not just for you, for the people around you. If you do it for someone, I believe you've done a lot for that person. Thank you very much.